Just last month, the feds released research revealing that a potentially life-threatening red meat allergy may impact almost 500,000 Americans. Alpha-Gal syndrome is linked to a bite from a Lone Star tick.
While experts at the University of Maine Tick Lab say the number of Lone Star ticks found in our state is still very small, some patients are working to require state health officials to track cases of alpha-gal among Mainers. News Center Maine's Vivian Lee has more.
Beth Carrison was diagnosed with alpha-gal syndrome a decade ago, but GI problems and unexplained rashes had started years before, after she found an embedded tick. But she couldn't figure out what was happening until a whiff of bacon in the grocery store caused excruciating hives. While she is now in remission, she is always on guard against ticks and other life-threatening exposures.
I was anaphylactic within 3 minutes of being around somebody's perfume that was left on their coat from the night before that had a mammal carrier in it.
Alpha-gal syndrome is a tick-borne illness that leads to allergic reactions from eating red meat, including the meat of cows, deer, pigs, lamb, or goats. Some people also develop allergies to dairy and other byproducts from processing those animals, like gelatin and cosmetics, primarily linked to a bite from the Lone Star tick. But other ticks, including the black-legged or deer tick, have not been ruled out. Experts at the UMaine Tick Lab say while there are no established populations of Lone Star ticks in our state, more are being brought in from other parts of the country where there are much higher numbers. Unlike other food allergies, the wide-ranging symptoms, including swelling of lips, face, or throat, can take hours or even days to show up. 110,000 cases of AGS has been detected across the country since 2010, but recent reports by the U.S. CDC found that number could be as high as 450,000. One federal study found more than a third of 1,500 doctors surveyed had no idea what it is or how to treat it.
Physicians are not educated on alpha-gal syndrome and the far-reaching impacts. They just aren't.
Dr. Herb Cushing, an infectious disease specialist who does infection control surveillance for the Northern Light Health System, disagrees. He says patients with mild to moderate symptoms can be managed with antihistamines, adding that newly updated diagnosis and treatment information for AGS on the CDC's website is also beneficial for both patients and providers.
If you walked into your office and said, I think there's something I'm eating with meat that I'm reacting to. I'm getting hives, or I have terrible GI symptoms. They'll figure it out with you.
Beth, who served on a federal tick-borne working group that provided nearly 100 recommendations on alpha-gal syndrome to the feds, helped co-found Tick-Borne Conditions United, which offers education, training, support, and advocacy for AGS and other tick-borne diseases. The nonprofit has launched a campaign to get Maine and states nationwide to add AGS to conditions reported to the U.S. CDC. For her safety, Beth carries this medical alert card stating her allergies to red meat, including drugs and medical devices that can contain mammal products.
My fear is not so much the dining out and eating out, frankly. My fear is I get in a car accident, I can't speak for myself, and they start putting things on me, in me, and around me that's going to cause a reaction.
And she won't stop fighting to ensure patients and providers know the facts about this potentially life-threatening allergy. In Shapley, Vivian Lee, News Center, Maine.
A spokeswoman for the Maine CDC tells News Center Maine the agency will review and respond to any new legislation concerning mandated reporting of alpha-gal syndrome cases.